Is there something that I should be doing in advance? Lotions, vitamin E's, diet the night, a couple days before, arnica for bruising. Is there anything that you would recommend for?
Well, we'd certainly recommend arnica for bruising, and in advance of liposuction, we would tell you for at least 10 days not to take any aspirin or aspirin-containing products or any of the NSAIDs, the non-steroidal anti-inflammatories, because those cause increased bleeding.
10 days, okay.
If you take megavitamins, you shouldn't take any megavitamins. You can take one multivitamin.
Okay.
But for the most part, you are the package that you are. You're not going to change your result in 10 days or 2 weeks or even a month or two of dieting or exercising.
It doesn't change?
No.
Okay. You mentioned about being out of commission for that day. I'm not supposed to drive here or home. Someone's supposed to bring me and pick me up, right?
Correct. Medical legally, we can't let you drive home.
Okay.
We do give you some Valium and a Percocet.
Okay.
And I maybe shouldn't say this, but most people have driven more impaired than what you'll be after your procedure, but we can't let you do that. That's up to you. But the day of your surgery, it's not a normal day for you.
Right.
We do give you some medications.
Okay.
You'll jump off the table and you will feel fine.
Yep.
I'm sure you would be comfortable driving home, and this is just to tell you exactly how you'll feel, but we won't let you drive home yourself.
Okay, so like Advil that night and I'll be fine, and
Well, again, Tylenol.
Yeah.
Or some of the narcotics that we would prescribe is good because we don't want you to take anything that causes some increased bleeding. So, and Advil's one of those class of medications that causes some increased bleeding.
Ooh, good to know. Okay, because I didn't know that. All right, you answered about my fat question. Will it be easier, if I go back to my really rigorous exercise and we do my arms, will it be easier to show muscle definition after I've lost some of this fat? Would that be a benefit of?
There's no doubt. The smaller your subcutaneous, your fatty level and its thickness, the more your defined muscle will show through.
Okay.
That's why the bodybuilders with 2 to 3 to 4% body fat see the ripples in their muscles.
Right.
That same amount of muscle toning in someone who has an increased amount of fat, the fat hides the tone. So that the smaller you are, the thinner your subcutaneous tissue, your fatty layer, the more your muscles will show through.
Now, I had heard you've done men's breasts for that reason, that it helps sculpt their chest, their muscle, their abs.
Right.
Yeah. Oh, okay. All right, then that does make sense. Scarring at the incision sites, is that?
The incisions are 2 to 3 millimeters, so they're this big.
All right.
So that yes, you'll have a tiny little scar. If it does get a little beat up or is a little depressed, we can 2 months down the line just cut out, excise that scar, and put it back together. Scars from this procedure are insignificant.
Okay, all right, that's good to know. And curves. I'm curvy. I don't want to get rid of my curves. I want to tone down my curves. The upper body small waist, but I have not extremely large hips. But this is what I want to do is curve down my curves.
Again, I'll show you. We'll go into the other room in a second, and I'll tell you about it. But again, this is not Smart Liposuction is not for complete circumferential reduction of a body part.
Yep.
It is to take an area that has a beginning and an end and bring it into better proportion to the rest of your curve. So if you have a bulge in your outer legs that bulges much more than your buttocks and lower legs, we'll be able to bring that in.
Okay.
I can't, if you have a fabulous shape but are just too big, Smart Lipo's not for you.
Okay. You're sculpting.
Right.
Okay.
Or sculpting, but removing isolated areas that are out of proportion.
Okay. Well, I think you've answered all my questions. That was great. Scarring at the incision sites, is that?
The incisions are 2 to 3 millimeters, so they're this big.
All right.
So that yes, you'll have a tiny little scar. If it does get a little beat up or is a little depressed, we can 2 months down the line just cut out, excise that scar, and put it back together. Scars from this procedure are insignificant.
Okay. All right. That's good to know. And curves. I'm curvy. I don't want to get rid of my curves. I want to tone down my curves. The upper body small waist, but I have not extremely large hips. But this is what I want to do is curve down my curves.
Again, I'll show you, we'll go into the other room in a second and I'll tell you about it. But again, this is not, Smart Liposuction is not for complete circumferential reduction of a body part.
Yep.
It is to take an area that has a beginning and an end and bring it into better proportion to the rest of your curve. So if you have a bulge in your outer legs that bulges much more than your buttocks and lower legs, we'll be able to bring that in.
Okay.
I can't, if you have a fabulous shape but are just too big, Smart Lipo is not for you.
Okay. You're sculpting.
Right.
Okay.
Or sculpting, but removing isolated areas that are out of proportion.
Okay. Well, I think you've answered all my questions. That was great.
Let me just show you before we go. These are the two steps. This is the actual cannula, the tube that we use for lasering. It has a little orange laser fiber that goes through it. This is what I first used deep in your tissue to melt the underlying fat. The reason for going deep is so that we try to maintain the upper layer of fat with its nice normal thickness, again to prevent rippling and dimpling. Then we go right underneath your skin with a different wavelength, and we heat the skin, and that stimulates the skin's contraction. Now you can see very faintly there's a tiny little wire down this tube. This is the latest generation Smart Lipo cannula in that this little wire gives us an exact readout of the temperature at the tip of this cannula. The Smart Lipo before this didn't have that. We would use a gun at your skin to maintain temperature, and the safety of this operation is all about temperature. We then found out that your skin temperature didn't necessarily have a correlation with the temperature 2 or 3 centimeters below, and you could be much hotter below than you were at the skin. This gives us an exact readout of the temperature wherever we are, and we can actually set the machine to slow down and cut off if it reaches a certain temperature, so that the risk of burning is almost nil.
Will I be able to feel the heat? What will I be able to feel?
Well, initially we'll give you that sedation, that oral sedation. I'll inject you with a little local anesthetic. Then with a cannula similar to this, but not this one, we'll infuse fluid that has anesthetic in it, that has other chemicals that eliminates any burning as I infuse it. It has a chemical that reduces blood loss, and just has a lot of fluid that breaks up your fat. Once that solution is in your body, you'll sense motion and you'll sense touch, but you won't have any pain whatsoever. You'll lie there.
But I'll be able to feel if you're where you are on my leg. Just like pressure.
You'll feel where I am,
Pressure.
but you'll be so comfortable that we've had patients talking on their phone while we do it, when their friends call. We've had people downloading movies and watching movies.
Okay.
And since the procedure is somewhat labor intensive and lasts a good long while, we get to know each other very well during the procedure. So we'll ask all your deep dark secrets. Anyway, so the final step is to take this cannula, which is about 1/3 to 25% the thickness of traditional liposuction cannulas, and suck out the melted fat that we did in the first step. Then we put a little incision in each one of the entry points that we use, put a dressing on, put you in that compressive garment, and
away we go.
Away you go.
A few hours later, it's all sculpted.
Well done. So now let me look at you.
Okay.
We'll look at you,
and
I'll draw on you and show you exactly what I think I can do for you. Tell you exactly what I think as far as whether you're an excellent, good, or fair candidate for the procedure.
Okay.
And then we'll take some pictures that we can look at here, because it's much easier in my consultation for you to look at pictures of yourself rather than to look back like that.
Yeah.
To see what we're talking about.
Okay.
So let's go next door.
Okay, great.